Hello everyone. Now in today's video, I have brought a WHO checklist which is very much common and is usually asked in nursing exams in nurses. So let us see. So this is how the WHO checklist will look like, and you can see it has three partitions, and which is we are having a sign in, timeout and sign out. Let us study. So WHO checklist compromise around 19 topics are there, or many times it has been asked how much content or how much points it's having. So it is total 19. So let us see from the beginning. So if today any patients is planned for OT, like for example for LSCS, so you will see this WHO checklist before going to OT. It is the responsibility of a nurse to keep this checklist, surgical checklist for the OT preparation. So when the patient arises in the OT, the surgical checklist has to be read out with the from a nurse. The nurse will read out, the circulatory nurse especially. So before the induction of anesthesia, that is known as signing. Before induction means with anesthesia has not been started yet. So sign it. In the sign it parameters are patient will confirm that is the name of the patient. So we will ask the patient, what is your name? Aapka naam kya hai? Then the patient will tell his name. So we'll confirm with the file whether we are receiving the correct patient or not. Then we will see the site procedures and we will make sure the concerned paper has been signed. Then the site is marked if it is applicable or not. It has to be marked. Anesthesia safety check should be completed from their side, and pulse oximetry on the patients and functions has to be done. So again, we have to ask that the patient, do you have any kind of allergy, or patient is having any kind of allergy? So it has to be known before the induction of anesthesia. So yes or no. And is there a difficult airway aspiration risk is there? Yes or no. Or then the risk of more than 500 ml blood loss, yes or no. If yes, then adequate intravenous access and fluids, whatever it has been planned, it has to be before it has to be planned out. So these were the parameter signing. Time out means before the skin incision has been started. So when the circulatory nurse will call up timeout time, so all the members within the OT will confirm their name from the surgeons. Everyone will tell their name and they will introduce themselves. So confirmation, all the team members have introduced themselves by the name and the roles. Then surgeon, anesthesia professional, nurse verbally confirms the patient, the site and the procedure. So they will tell the patient name is this, and this is the site, and we are going to do this procedure. Then again, anticipated critical events. The surgeon reviews what are the various critical events and unexpected things it has been, and what amount of anticipated blood loss. Then anesthesia team reviews, are there any patient specific concern? It has to be asked from the anesthesia team. They will tell if any kind of concern, they will clear it out. The nursing team, so has the sterility including the indicators results been confirmed? Are there equipment issue or any concerns? So nursing team has to tell. Again, if the antibiotic profile, it is seen that before any kind of before the patient is received, they usually get a full dose of antibiotic, or they will get in within the operation. So it is confirmed whether it is given or not within the last 60 minutes. It's different in different hospital policies. Is essential imaging displayed or not? Yes or no. Sometimes surgeons in drop time, they need any kind of x-ray report, so it has to be displayed. Now last is sign out. So before the patient leaves the operating room, the nurses confirms with the team the name of the procedure recorded, that usually all the instrument count is done. So it is the responsibility of everyone. The instrument counts, everything has to be confirmed. If any kind of extra sponges has been taken during the procedures, it has to be noted. It has to be added, because complete count should be completed before the patient leaves, so there should be no error. Many cases it happens, so we should be very much careful how the specimen is labeled. Like some samples are taken in intra-op, that sample has to be labeled within the OT. Either sometime they will put normal NS according to the specimen, or and it has to be labeled and sent to the lab. Whether there are any equipments problem to be addressed, and again the surgeon, anesthesia professional and nurses reviews the key concern for the recovery and the manageable. So finally, this is the WHO checklist, and thank you for watching my video. Thank you.